Welcome to Open BXRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. A new COVID-19 treatment is helping hundreds avoid hospitalization here in the Bronx. It's called the Monoclonal Antibody Program at Montefiore. Joining us now to tell us more about this treatment, who qualifies, and more is Dr. Una Hopkins, Director of Nursing of the Monoclonal Infusion Suite at Montefiore Health System. Welcome, Dr. Hopkins. Thank you so much for joining us today.
Thank you for having me. I appreciate it.
Of course. Before we begin, can you just tell us a little bit about yourself and your work at Montefiore?
So I'm a doctorally prepared nurse practitioner, and because of my history in oncology and the use of monoclonal antibodies in the therapies that I was delivering, I was best suited for the opportunity to bring our monoclonal antibody infusion suite up and make it running as efficiently as it is today.
Thank you, Dr. Hopkins. Really important work you're doing. What exactly are monoclonal antibodies? For those folks tuning in, we're a little jarred by the name.
So monoclonal antibodies have been around for a long time. We've used them in our oncologic ways to treat patients for a long time. But basically what they are is they're man-made proteins that act like human antibodies in the immune system. They mimic the immune system's ability to attack an antigen. And that's what the COVID-19 virus is. In the COVID-19 virus, it has a spike protein on it called ACE2. And our monoclonal antibodies attach to it and therefore decrease its ability to replicate in our body with the hopes that it will decrease symptomatology that the patient experiences.
Got it. Now, Dr. Hopkins, you have the monoclonal antibody therapy treatment over at Montefiore. When did Montefiore start this program, and how many patients has it helped so far?
So it is under emergency authorization use by FDA. The combinations, there's several. There's a combination by Eli Lilly and there's a combination by Regeneron. We started to use the combination and monotherapy in December 2nd, shortly after they were approved. And to date, we've treated well over 800 patients.
And how exactly are the antibodies given? What is the process like? Is it painful at all?
So it's an intravenous infusion. It's given over about 20 minutes with a 1-hour observation period shortly there, immediately following the completion of the infusion. It's not painful other than the prick that you feel for the needle to go into your arm to get the IV access. But other than that, no, it's not painful.
Got it. And who exactly qualifies for this treatment? Which are the eligible high-risk conditions that qualify for the treatment?
So under emergency authorization use, you have to be COVID positive. You can be COVID positive by PCR test or by rapid antibody test. And you also have to be demonstrating symptoms within 3 to 10 days. So the treatments in the clinical trials were shown to be much more beneficial if it was given earlier in symptomatology. And the patients that are at high risk are those that are obese or having a BMI greater than 35, have any kind of chronic kidney disease, have any kind of diabetes, anything that's immunocompromising, such as the treatment for undergoing for an oncologic condition or a transplant of any kind, whether it's kidney or liver or lung. You can be over 65 years old or over 55 with hypertension. And you do not need all of these. You just need one of those high-risk factors. So you need a positive COVID test. You need to be within 3 to 10 days of symptom onset and have one of those symptoms that I just mentioned above.
Dr. Hopkins, why is it important to provide this alternative here in the Bronx in particular?
Well, the Bronx, as you know, has been a very, very hard-hit borough for COVID-19. And our patient population has succumbed and had great losses from COVID-19. So therefore, if we can administer a therapy to someone within 3 to 10 days of symptom onset and keep them out of the hospital, they have a much better survival rate. And looking at our own personal data here at Montefiore, we've been able to maintain a hospitalization rate of anywhere between 5 and 10%, depending on which month, which means that we're keeping over 90% of those patients out of the hospital.
And is this therapy treatment an alternative to the vaccination, doctor, or is it something as well as a vaccination? Can you clarify a little bit on that?
What a great, important question. If you have the opportunity to take monoclonal antibodies and you do so, you don't take the vaccine for 90 days. That doesn't mean that you shouldn't be vaccinated, but you can't or should not be vaccinated for at least 90 days post your monoclonal antibody infusion. We give our patients a very specific card, if you can see what I'm holding up here, and it basically goes and tells you the date that you had your monoclonal antibody infusion. And that is to help our healthcare providers know that you should not have vaccine until 90 days following that date, because they compete and you don't want competition in your body, because if the monoclonal antibodies are helping you mount that defense, then you don't want vaccine, which is also going to help you mount a defense.
Okay. So does the patient have a choice whether or not they want to get the vaccine or the monoclonal antibody treatment, doctor? Is that something that they should decide?
Yeah, they do have a choice. So in our screening process, and it's multidisciplinary, so we have physicians, we have infectious disease physicians, we have nurses, and we have pharmacists all screening patients. So if they've already received maybe one of their two-dose vaccine regimen and they have symptoms that are likely to progress, then we do advise them to get the monoclonal antibodies. If their symptoms are very mild, such as a mild headache or mild nausea, and they don't progress within that 3 to 10 day, we encourage them to stay on their vaccine regimen. So if they're due for it in a week or 2 weeks or whatever. But it really is very important to make that assessment from a clinical person to help that patient make that decision, because it is their decision.
Right, absolutely. Are there any allergic reactions or symptoms that we should worry about when it comes to the treatment?
Well, we haven't seen too many allergic reactions at all. Actually, none that have been serious enough to send somebody to the hospital from the infusion center. We've seen mild symptoms such as nausea, which we can take care of with a medication, or slight fever, which happens to be managed with some Tylenol. So for the most part, no. And our patients are feeling much better. We give them a call about 24 hours after their infusion, and to make sure that they are continuing that progression of feeling better and that their symptoms have not gotten any worse.
Dr. Hopkins recently had a success story with a 7-year-old patient named Irma Vega from the Bronx. Can you tell us a little bit about her case and, about the success story with the monoclonal antibody treatment?
So it's really important to know that, there are a lot of success stories here. We have well over 800 success stories. But the bottom line is each individual patient is treated as an individual. And she was just so happy because she was not on a vaccine list. She hadn't been able to get herself onto one of those lists, but to make sure that she could feel better and not get worse and be hospitalized, I think was really, really important to her and important to the rest of us, obviously, because that's what we want to do. We want to keep patients out of the hospital.
Now, without further ado, how can people find out more about this treatment and get in touch with Montefiore? Is this something that's a process with a primary care physician, or how can people get in touch?
Your physician or your city MD or an urgent care, anyone. If you're inside the Montefiore system, we have a HIPAA compliant email. It's called COVIDASP@montefiore.org. That's if you're in the Montefiore system. We also have an externally facing self-referral ability, and that is COVID antibodies@montefiore.org. COVIDANTIBODIES@montefiore.org. And that is for those that are external, such as our city MDs and or patients with family members. Sometimes the one family member will test positive before another, and they'll come in. And again, it's most advantageous to take the monoclonal antibodies in the early onset of infection.
Got it. Before we go, Dr. Hopkins, just a quick message to the community in the Bronx about, taking the right treatment and seeking the right help with, especially with preventative care. A lot of folks are afraid to go to their doctor nowadays, through COVID-19. Just a little message for the Bronx community.
Oh no, you should absolutely take care of yourself, whether it's hypertension and or diabetes or obesity, anything that requires any kind of health attention, you should continue to go because there's lots of options now. They can do telemedicine with you, or they can do a telephone call, and they can get some symptomatology from you and understand whether you actually need to come in or not. And of course, screenings are absolutely of most importance. So whether it's a breast mammogram and or a colonoscopy, all of those are very, very important preventative opportunities for one patient to continue to do.
Yes, I'm glad you brought up colonoscopies, doctor. It's March is Colon Cancer Awareness Month, so it's super important for people to get that preventative care out of the way as well, no? And things
Yes,
are safe. Things are safe at Montefiore, always.
yes, they are.
Thank you so much, Dr. Una Hopkins, Director of Nursing for Monoclonal Infusion Suite at Montefiore Health System, for joining us today.
Thank you.
Of course. We'll be right back here on Open BXRx.